10:30, so we will go ahead and get started with today's webinar. The usual housekeeping item, if you have questions today, please make sure that you drop those in the chat and that you address those to all panelists. We do have a couple folks that are out today, so there may be some questions that we'll need to take back and get you a response at a later time, but we'll definitely do the best we can to get you those responses quickly. So with that said, I'm going to ask Kat to do some driving for me, and I want to make sure folks know some resources that we have out on our division webpage. So Kat has pulled up our main division landing page. So you'll see the web address up there. Hopefully folks, they're very well savvy in navigating at least this page. So if you click into that web page though on any button, doesn't matter what you click, it'll take you one layer into our website, and once you get into that next layer, there's a side navigation box. So Kat, if you'll just click us in anywhere, that'd be great. So that side navigation box there, that is that light blue color, you will see that we have a new item added there, and it says Event/Training Calendar. So if you click on that, you'll see that this is another location where you can find all of our upcoming scheduled webinars, but you will also see under that first recording that in addition to those webinars, there are other trainings available. So I'll wait till that shows on the screen. Kat, if you'll open up that accordion, please. There we go. So there are some standing trainings and meetings that we have that are ongoing. So you'll see that we keep those listed at the top. There are also other trainings down within this that you can take a look at and get additional information. So with that said, please check back on a regular basis. Know that that's there. We'll continue to grow and expand what we have available in that one-stop shop. As you can see, you can get to it from the side navigation box, and it also lives on that education page. So be aware of that, and now you know how to drive there. So Kat, if you take us back to the main landing page, I want to make sure that we can also show folks how to navigate to another page. If you will, click on the green button for information for individuals, families, and guardians. Yep. And if you scroll down, you will notice that there is an accordion titled, How Do I Access Division of DD Services? Under that accordion, we have a customer journey map. And so if you click on that customer journey map, you will see we have, and I love to call it the simple step-by-step guide. As most of you know, there isn't anything that we can necessarily label simple. However, we have tried to put something out there for folks to take a look at that breaks it down a little bit and doesn't seem quite so overwhelming for folks to follow. So you can print that, you can share that with folks. That is one way to get to it. You can also get to that document via the main landing page. We have that scrolling carousel. That first panel is always COVID-19, but one of those panels will also take you there. So if you forget where you're supposed to click into, it is on this panel. So another item I want to make sure that folks are aware of, and again, going to have Kat drive you there from that main DD landing page. If you scroll down, there's a community supports tab in that popular section. You click on that, you will see that there is a self-advocacy title section. Click on that, and once you get in there, not only will you see various things that support that self-advocacy, you will see a section for easy readers. So those easy readers are plain language documents that have been produced that are plain language, easy to read information, and they hit on various aspects and provide resources as it aligns with the division. So take a look at those. Know that those are available, and going into 2023, we will also be producing some additional ones. So make sure that you check back. And then the last item that I wanted to touch on was, again, main landing page, that purple button, Connect with Us. If you're not following us on social media, we absolutely encourage you to do so. We do push out on all 3 platforms. Right now, Facebook is the one that we have the most traction and efforts going towards, but we are building up the other 2 platforms as well. So you can take a look. There's previous dashboards. We have monthly dashboard there that shows the traction. So by all means, if you're not following us, interacting with us, we ask that you do that. So if there's not any questions about any of those things, let me back up. If there are questions, please by all means drop them in the chat. I'm happy to answer those, make any connections that you need. But if there aren't any questions at the moment, I am going to go ahead and hand this off to Lucas to talk to us about some MOAD information.
Excellent, thank you, Heike. Good morning, everyone. So I want to just give a quick update on some additions to the MOAD site on our webpage. So if Kat, if you could navigate there by going to the community sports tab under popular sections, positive behavior sports. And then there is a MOAD button. One thing I want to call attention to, go ahead and click that. One thing I want to call attention to right away, if you notice up in the URL tab at the top, you see that it's that MOAD is listed under DMH. So we're currently moving it around our website. And so you can always get to it from the link path that Kat just demonstrated, but you may also be able to get to it from a different way that's less clicks in the near future, and we can show that when it's ready. So just keep that in mind. But you'll always, the path that Kat showed you is still a good path to get here. And we, as you all probably were aware of, we had a task force that came together to establish some best practices. We've had an app out there for about a year now, but we also now have a written manual that kind of covers those best practices. So really, what I want folks to understand is there's support for clinicians and for teams out there on identifying what are the best practices for individuals who have behavioral health concerns and intellectual development disabilities, specifically when they're dealing with things like substance use, self-injury, aggression. And there's several ways to access that information. So there is a guidebook that has 2 different formats for folks. So if you want to look at it on your screen, which is probably the best way to do it, you can get a PDF version of it that is formatted for screens. And if you want to print the book out, so it is a book, but we didn't bind it because most people don't read paper books. But in case you want to print it out, we have a printable PDF as well that looks nice printed up. It actually looks real snazzy. There was a lot of work that went into making this look like a really polished document, so we're really proud of it. And then you could also access that same information in the app in a little bit different format that can kind of guide you through the information that you need to get to. So please check that out if you haven't. It's a really great resource. There was a ton of effort over a period of a couple years that went into making that happen. And so we're just really excited that it's out. You may have seen a press release alongside of it. So we're really just trying to make sure that folks are aware this resource is here. And so wanted to give a brief demonstration of how to get there. All right. And then it doesn't seem like there are any questions about the MOAD stuff, so I'm going to go ahead and move on to my next topic, which is Jess asked me to talk about 988 and mobile crisis and how DD intertwines with that. So I'm going to try to speak generally and start with a little bit of context setting. So the general idea here is that, like Val has mentioned, when it comes to reconceptualizing how state-operated programs work, we're really trying to recognize that we're part of the same department, that we are responsible for serving individuals that have behavioral health concerns and intellectual and developmental disabilities, and trying to becoming more integrated in actually how we operate. And if you remember back, 10 plus years ago, we actually kind of had 3 silos. So right now we have our sister division of behavioral health, we have the division of DD, but we used to actually have kind of 3 silos: substance use, mental health, and DD. And over the last probably decade or so, mental health and substance use have come together to be behavioral health. And now we're really working on trying to integrate the care between DD and behavioral health, not like in a structural way, like we're not going to reorganize the whole department, but in a practical way for the people that need services in our communities. And crisis is one of the key areas that we're starting in. The Division of Behavioral Health has operated a crisis system for Missourians with behavioral health needs for almost ever, not really forever, but for a very long time. And nationally, there's been this rollout of a new system called 988. So before, there was various different hotlines that you could call depending on what region you're in each individual state, but now there's a national number, it's 988. And that's rolling out in Missouri. And Dr. Stanislaus and I, Dr. Stanislaus, Chief Medical Director, and I have been working really hard to ensure that this is a viable option for individuals who have IDD in our system and in our communities. And the idea is simple. The SAMHSA best practices for what makes a crisis system for any state and for our nation says that it has to be available to anyone at any time, anywhere. And they're explicit in saying that folks with IDD count within that, which is actually a pretty huge step. And there's a pretty significant national conversation happening about this topic right now, about how this is a huge need in all states and in our country to integrate crisis care, behavioral health care for folks with IDD. That's kind of been a missing piece for a really long time. And so the idea is simple. This is something that everybody should be able to access. The making it happen part is kind of where we're at right now. And the realities of it is, first, we're trying to establish the standards. Everybody is on board. I haven't talked to anybody recently who on the behavioral health or the DD side that doesn't think this is a good idea. The practical part of making it happen is where we're kind of working on now. So we're making sure that the standards align to make it possible and don't create barriers for individuals with IDD to access mobile crisis response and the 988 number. And then we're also making sure that the operators who receive the 988 calls, the team members who respond to the mobile crisis calls, have the skills and the tools necessary to show up, support somebody who's in a behavioral health crisis who happens to have an IDD, and make sure that those folks don't end up in jail, don't end up encountering law enforcement when they don't need to, and don't end up stuck in ERs when that's not the most appropriate place. So we're also working, in addition to mobile crisis teams in the call centers, we're also working with the behavioral health crisis centers to develop training and resources that they would need to be successful. And I'm very proud to say that the behavioral health community, both at the division level and in the contracted space, so the Behavioral Health Council and the member CMHCs and community behavioral health organizations, are very committed to working closely with us to try to figure this out. Everybody believes that this is an area that we need to do better in, and so I couldn't be prouder to be a part of working on that. So I just wanted to kind of give a quick overview and give some updates and answer some questions if I could. I see there's one in the chat. I'm reviewing it now. I may reach out to you, Julie, offline to kind of get a little bit more information. I think there's maybe some additional information that I would need to try to address that, but I'll try to reach out to you on the side to try to figure that out. And that is good feedback, and I want to talk to you a little bit more about that. Oh, thank you, Heike. Oh goodness, if I didn't have Heike, I would be lost. Okay, so Julie had asked or said, I spoke with an organization who said that they cannot use 988 as much as they would like due to the legality of not having someone come physically to the person. Oftentimes, someone needs to take someone to a crisis center or hospital, and 988 can't do that. The organization still has to call the police most of the time. So again, I want to know specifically about this situation so I can better help, but just generally the way it should work. And this is an ongoing project statewide, not just for folks with IDD, but 988 is going to be part of what's called Mo Connect, and it'll be linked into mobile crisis teams, behavioral health crisis centers. This is the plan. It's being phased in, and so they would have the access to dispatch somebody who can actually go and respond, a mobile crisis response, to someone in need, and then that also would feed into a behavioral health crisis center, so they could either make the referral, they could either get somebody to the crisis center, they would know if somebody shows up at a crisis center, and then the crisis center should be able to access kind of a listing of up to date real-time information of where there's capacity for follow along service and make sure people get linked up. Like, that's the idea. We're not there yet, but Mo Connect is for real. They're phasing in users of that to make sure that everybody has access to that system. So the 988 call centers and the crisis piece is already working. The follow along services is coming on board slowly over time. So yes, I do want to find out a little bit more, Julie, about that specific situation, but technically that's how it should work over time. So if that's not happening, then we definitely want to hear about that. Okay, so I don't see any other questions. If folks have additional, yeah, so Julie, I'll reach out to you separately. Please don't type in specific information into the chat. I'll reach out to you and continue to ask questions if you have them. I can respond later on. I'm going to go ahead and hand it off to Emily, I believe.
Thanks, Lucas. I'm going to start by giving some updates that you may have seen or maybe you missed in email blast that went out from the division that you should be aware of, and make sure that if they are applicable to you that you go out and sign up for these for the trainings or the webinars. The first one is related to the final connection demo walkthrough, what to expect. You should have seen, or maybe you saw this morning, we have a new date for that webinar for the demo. The new date is January 23rd from 1:30 to 4:30, and a email blast did go out this morning, and the webpage has been updated. We did move this because of the state of the state that is on the 18th. This webinar will showcase the requirements gathered and configuration in connection around the ISP planning and service authorizations, and focus areas for this demonstration will be highlighting the ISP planning process in the system and all the modules that interact with the ISP and service authorizations. So again, you can find this email blast on our DMH webpage and register for this demo, which is definitely important for those as we move towards going live with Connection in July of 2023. Another webinar or another blast that went out was related to Connection, and that's the companion guide. The division of DD, Case Management System Connection, is scheduled to go live on July of 2023, and Connection will replace Seymour for all DD waiver and purchase of service billing. So our POS billing. Connection will support an electronic submission of claims as well as an online data entry. Providers who currently bill electronically to Seymour will need to make adjustments to be able to submit claims to Connection. And that's where the Connection Companion Guide will be helpful for submitting your electronic claims, and the Connection Claims Error Codes list will provide information regarding these changes. And then another reminder that went out through our email blast was related to our post-discharge hospital reimbursement program. It's a limited funding has been approved for hospitals to receive reimbursement of expenditures related to individuals who qualify for placement and support through the division, who would otherwise be eligible for discharge. So those individuals that are not able to be discharged for reasons related to possibly not finding a provider may for a specific period of time, due to the lack of availability within the appropriate community placement, may qualify for post-discharge hospital reimbursement, and hospitals that are interested in this funding may complete and submit a reimbursement agreement and attestation. And all those links to those memos, the attestation and agreement and documentation form are available in our post-discharge hospital reimbursement email blast. And then from a waiver standpoint, which is kind of where me being with federal programs unit, some great news that we received this week was that CMS approved the value-based amendments. Amendments effective January 1st of 2023. These amendments, if you're familiar with them, you'll know we've been talking a lot about the 9 incentive payments for personal assistance providers participation in EVV, completion of the DSP training levels, tiered supports reporting and implementation, employment service reporting and participation in the DSP apprenticeship program, implementation of remote supports, and completion of the HRST assessment and the NCI staff stability survey. So there were 9 incentives around one incentive around each of those items for supplemental or enhanced payment, and they were approved by CMS for a start date of January 1st of 23. As well as the incentives, we had also approved an increase in the environmental EAA, or environmental adaptability accessibility adaptation, a home and vehicle modification. So our home and vehicle modification maximum limit was changed from $10,000 per year per individual to $20,000 every 2 years. So it allows for some flexibility for projects that are jobs that are above the 10,000 now can hopefully fit in within that 20,000 for every 2 years to get completed. That is also effective January 1st of 2023, that new limit for our EAA, home and vehicle modification. And then also with the amendment that was approved, we had updated the direct support staff provider qualifications to allow the completion of the level 2 DSP training to meet the high school GED requirement. So if you're familiar with the requirements around DSPs that require a high school diploma or GED, we now will allow a level 2 direct support professional or DSP trained completion of that training within a year of employment to satisfy the provider qualifications for direct contact staff. And then from a value-based team update, we're continuing to move forward with our 9 incentive payment implementation. And now that we have the CMS approval, that's one more step towards implementing the payments. Our provider contract language review and provider data collection training webinars are scheduled for January 4th and January 10th. And if you are a provider who is interested in incentive payments, and the ABP team encourages you to attend one of these sessions so that you will have the information you need and the training to start entering data and data collection and requests for the incentives. So again, those are on January 4th and January 10th. There was a blast that was sent out for those as well to get registered for those. So we want to encourage you to do that. And then, as I mentioned, it will also be provider contract language review in those sessions. And another update on waivers is we are working on our Partnership for Hope and MoKids waiver renewals that are due July 1st of 2023. If you remember, all of our 4 waivers have to be renewed every 5 years. A couple years ago, we did comprehensive and community, and now it's time to we're on schedule to renew our partnership and MoKids waiver. And then we'll also update the comp and CSW to align with the renewals. We anticipate announcement for posting for the formal public comment for those waiver renewals to start on Friday, December 23rd. The Department of Social Services and Mo Health Net will take comments for 30 days on the renewals, and those renewals, as I mentioned, will be submitted to CMS next year with an effective date of July 1 of 2023 with CMS approval. And lastly, an update on our DD Health Home. If the DD Health Home team is consisting of members of multiple units within the division, continues to move forward with the Health Home initiative. This past week, they held 3 stakeholder webinars to provide education on the Health Home roles and answer questions about the Health Home from all the stakeholders that attended. They continue to work with the ad hoc team to consider feedback from stakeholders and adjust the plan as needed. They will be working hard this coming year to submit the state plan amendment, or the SPA, to CMS for approval. They'll be writing a Health Home CSR and continuing to work on reporting and development of education, along with other tasks that go along with implementing a DD home. That's all the updates I have for VBP and some of the other updates that the division has sent out recently. Just looking to see if I have any questions. I'm not seeing any to the panelists. If there's anything that's gone to the host, let me know.
So far, no.
Okay, thanks, Kat. Go ahead, and if you think of other questions for around the waivers or the other announcements that I have presented today, just go ahead and put those in the chat. But I'm going to turn it over to Leslie DeGroat now to talk further about the HRST and IQMFD.
Thank you, Emily, and thank you all. Good morning. And I'm glad to be joining you on this fine Friday morning. And okay, so for my 2 updates, the first one came out in an email blast on Tuesday from the division, and it's related to the IQMFD, or the long version, Integrated Quality Management Functions Database. It used to be the APP system, but we changed the wording there, so IQMFD. So changes with this system. Effective December 8th, changes were made to the IQMFD to streamline the process for end user data entry and data analysis. The changes are related to the filter provider text box when findings are entered, as well as the unresolved over 45 days and unresolved over 90 days reports. Additional details on these changes are located on the division's IQMFD webpage under the IQMFD database ribbon. And we're going to drop that link into chat so you guys can connect to that. And it has, and in the chat, just remember when you click on that, go to the IQMFD database ribbon, and that will give you the more information about what I just talked about. But if you have any questions, don't hesitate to let us know. Or if you come upon questions later on, don't hesitate to reach out. My second update is related to the MoDD Health Risk Screening Tool, or HRST process. Any DMH-DD service providers and targeted case management agencies can go ahead and implement the HRST process through May 1st of 2023. So you can start onboarding or with your implementation steps anytime. The statewide go live implementation phase will be effective starting May 1st of 2023. And I want to encourage you to visit our website, and don't hesitate to reach out at our mailbox, and we'll drop the website in chat as well as our email box It's moddhurstproject@dmh.mo.gov. And are there any questions? Thank you so much for dropping those in the chat. If you think of anything, don't hesitate to reach out. And with that, I will go ahead and turn it over to Wendy.
Good morning, everybody. I just have a couple things that I wanted to mention and talk with you about. The first, I wanted to talk about the health assessment and consultation service, also more commonly known as Station MD. We have gotten a lot of feedback from family members and guardians that there's a concern that using this service interferes with or replaces the primary care physician and the role that that primary care physician plays in the individual's life, and that is not the case. So I just wanted to take this minute to provide a little bit of clarification that this service is only to be an available option when getting to the doctor, availability to their primary care physician isn't available, or if you need to go to an ER or urgent care, and that's not a good option for the individual because you just get more exposure to more germs and illnesses and whatever is going around, and sometimes our folks just don't even deal with that environment very well. So this is really to be available when those other avenues aren't appropriate or aren't the best practice, and when their primary care physician is not available. So some families love to use the telehealth offering with their primary care physician. This is not a replacement for that, but would be available to you during off hours of your primary care doctor's office hours or your telehealth hours. So evenings, overnight, weekends, holidays, any of those times when your doctor's office might not be open. And the docs through Station MD do communicate and share the information and the contact information and what their assessment was with the primary care physician. So there is that good follow-up. And I just wanted to reassure folks that this is not a replacement in any way, shape, or form for the primary care physician. So just that little commercial for that service, and hopefully to provide a little bit of clarity there. And then I just wanted to give a brief update on our case management privatization. Things are moving along very well. We have one county that I reported the last time, Douglas and Wright counties, which is Webster County, which is down in our Springfield area. That transition is complete as of October 17th. So they are all operating privatized, and we have no more state case management in the Springfield area. We have the other counties and areas are all in progress with transitions being final, planned to be final by January 31st, with the exception of St. Louis. St. Louis is taking on 1,800 in that area, which is a really big lift. And so it requires a lot of recruitment, a lot of training of support coordinators in a fairly difficult market. So they will be starting to take on folks into their new support coordination program there in St. Louis beginning January 1, and will just continue to progress and take more people on as quickly as they are able to do that. So we will give you more updates as we have them going forward. So with that, if there is not, are there questions that have come up? I was going to say, Angie McGovern, I saw your question in there about the billing for TCM billing and connections. I'm going to reach out to our connections team to be sure that we get you the right information. So we will get back to you on that. And just looking to see if we have any other questions that have come up in the chat. I see a Hearst question here for you, Leslie. Is there a list of questions that the survey will ask when entering? If I do not have all the info, it restarts each time. No way to save past info.
I'd love to answer that. Is it okay if I share my screen? I'm gonna.
Sure.
Okay, because I don't have a list like pre-printed handy, but I can, if I can steal that thing from Kat, are you able to give me that little, you're on it, you're awesome. Okay, I'm gonna share my screen and I will show you what she's talking about if not everybody is aware, but once you begin your implementation process or onboarding process for the health risk screening tool, you can go to our webpage here, which we dropped in chat. And if you're a residential service provider agency, you can go to this ribbon here, support coordination information here, and then rehabilitation or employment service provider agency. You can go to that one. So I'm just going to pull up this one. They're all quite similar in format. I just want to let you know that we do have a recorded webinar for each one, and each is geared toward that specific type of service provider agency. We have some supportive documentation. Once you have watched this webinar, we would like for you to fill out these survey questions, and I'm just going to go ahead and pull that up as though I'm a provider agency and show you what that looks like. And the reason why we want this is because we'd like your contact information, and in the webinar it will let you know some steps moving forward, and one of the roles that you'll need to decide for your agency is what's called a gatekeeper for your agency, and that person will be responsible for getting people on your team access to the system or deactivating their accounts if they are no longer in that role for your agency. So that just helps us a lot, and then we can reach back out to you and help you move forward. But this will ask if you've watched the webinar, and I'm gonna say yeah, so you can move on to this part, and you'll put these, it says C must provide value, so you need your agency name, and there's a drop down there by how it appears in Seymour. So you can choose there, or if it's not on the list, you can always choose not on the list. And then it'll have a little box that says, but there's your contact. The number is not mandatory to move on. Emails, you'll want to make sure you have emails, and then you'll need to definitely put in what regions you're working for or working under, working in. And so I'm just gonna, it'll look just like this for the next section. You just really need those emails handy in order to put that in and move forward. That way we have a way to contact people. I hope that answers your question. I didn't fill anything out. I guess I could to kind of move on to what the next one will look like. So I'm going to put not listed, and I'm just going to put, and then put my name. But the gatekeeper one looks quite similar.
So Leslie, I think one of
Uh-huh.
her questions was that if they get to a point that they have to stop and they get interrupted in doing that, that it doesn't save the information and they have to start over.
Yeah, I am actually meeting with the lady who designed this next week. I can meet with her and see if there's a way around that. If you guys can go back to your what you had started filling out and fill it out, be able to pick up where you left off.
Okay.
But yeah,
Or I
but
think
make sure you have your people's emails and, oh, sorry, go ahead.
I was gonna say your suggestion was also if there's a way to get a list of all the questions so that they know that they have all the answers ready to go when they get in and start filling it out. That might be another workaround option that you could talk about.
Yes,
With
sounds good.
the
I appreciate
designer.
that. Yeah, sounds good. Thank you.
Thank you. So Kat and Heike, did we miss any questions? I think Emily is going to get an answer for you about the TCM billing. Angie. And I think, unless someone speaks up, that is all.
We have one question.
Which
Is
one?
is the brochure up to date for needed transfers to the Springfield area?
Okay, and I'm gonna follow up with the privatization team and confirm that, Cameron. I don't know the answer to that, and that's a great question. Appreciate you checking in on that. And so with that, seeing no other questions, I just want to wish everybody a happy holiday, a Merry Christmas, whatever holiday you celebrate this time of year. We hope that it is merry, that you stay safe, and enjoy a wonderful and happy and prosperous new year. Thank you very much. Bye-bye.